Hello everyone, I'm Pavani and today my topic is about nutritional blindness. Nutritional blindness refers to visual impairment and ocular changes due to vitamin A deficiency, which is commonly seen in children. And why is vitamin A important for our eye? This is because vitamin A plays a key role in our ability to see in the dark. Inside our retina, there are special cells called rods which helps us to see in the dark. So, these rods need a special chemical called rhodopsin, and vitamin A is essential to make this rhodopsin. If there is a vitamin A deficiency, rhodopsin cannot form properly. As a result, child finds difficult to see in the dark. This condition is called night blindness. Secondly, it is also important to keep our front part of eye, that is conjunctiva and cornea, healthy and moist. Normally our conjunctiva has a tiny cells called goblet cells. These cells produce mucus which mixes up with tears and forms a smooth protective layer on our surface of the eye. So, in vitamin A deficiency, these cells are destroyed, which leads to reduction in mucin. As a result, eye becomes dry. This condition is called xerosis. Over time, the dry surface becomes rough, keratinized. Keratinized means soft, moist surface like conjunctiva and cornea changes to dry, rough surface because it starts producing keratin abnormally. As a result, it can even develop white patches called Betot spots. Thirdly, vitamin A also protects the cornea, which is the clear window of our eye. So, without enough vitamin A, the corneal surface becomes dry, loses its shine, and in severe cases, it softens and melts. As a result, it leads to a dangerous condition called keratomalacia, which leads to permanent blindness. Finally, vitamin A is also important for our immune system. If it is deficient, children get more infections like diarrhea and measles, and the eye becomes more vulnerable to corneal ulcers. So, in summary, vitamin A is like a triple protector for our eyes. It protects the vision in the dark, it protects the eye surface from the dryness, as well as it protects the eye from the infections. This is why doctors and healthcare workers emphasize giving vitamin A rich foods like carrot, spinach, papaya, milk, eggs, and liver. And this is the reason why government provides vitamin A supplements to the children. And remember, vitamin A can save a child's eyesight. And next, coming to the clinical features, this is in order of progression. First, in vitamin A deficiency, the first clinical feature is night blindness, which we also call it as the nyctalopia. In this, the symptom is the child cannot see properly in the dim light or night due to lack of vitamin A. This is because the rhodopsin is not formed properly. As a result, there will be a dysfunction of rods which leads to night blindness. And second symptom is conjunctival xerosis. In this, the conjunctiva becomes dry and muddy, which occurs due to loss of mucin. And coming to the third symptom, it's Betot spots. These are the foamy, triangular, white spots on bulbar conjunctiva, which occurs usually on the temporal side. And next, it leads to corneal xerosis, which is dull, dry, hazy cornea, which occurs in severe vitamin A deficiency, and it leads to epithelial keratinization, loss of tear film, and finally drying. So even if this condition is not treated, it leads to keratomalacia. Keratomalacia means corneal ulceration and melting, which is caused due to collagen breakdown due to lack of vitamin A. As a result, it leads to corneal softens and may perforate, which leads to permanent blindness due to scarring. And the another symptom is xerophthalmic fundus. In this, there will be pigmentary retinal changes which appear in long-standing cases. And according to WHO classification of the nutritional blindness, WHO given different codes for different clinical features, which means XN means night blindness, X1A is conjunctival xerosis, X1B is Betot spots with conjunctival xerosis, X2 is corneal xerosis, X3A is corneal ulcer, which is less than one third of the corneal surface, and X3B is corneal ulcer, which is greater than 1/3 of the corneal surface. XS means corneal scar and XF means xerophthalmia fundus. And there will be also a systemic manifestations. That means due to vitamin A deficiency, the child will have the growth retardation and there will be a risk of respiratory and diarrheal infections because the immunity is affected. Coming to the management, in case of vitamin A deficiency, high dose of vitamin A, which we call it as retinol, is given. For less than 6 months of age, 50,000 IU is given orally, and between 6 to 12 months of age, 1 lakh IU is given orally, and greater than 12 months of age, 2 lakhs IU is given orally. And this dose is repeated on the day 1, day 2 and after 2 weeks. Apart from that, supportive care is also required. If there is any infections like measles and diarrhea, the infection should be treated. And for dryness, lubricating eye drops or ointment should be given. And if there is a corneal ulcer, it should be managed urgently in order to avoid the vision impairment and to prevent the perforation. So this is all about the nutritional blindness. If you find this video helpful, please like, share and subscribe. Thank you.